What's the one piece of career advice you wish someone had given you when you were starting out?
I think definitely take every opportunity as it comes. When I was younger, I most certainly would often hold back from putting myself forward, thinking that, oh, I'm not confident enough, or I'm not skilled enough, or I don't have this experience for a particular project or task.
Mm-hmm.
And as I have progressed or developed in my career, I thought actually you don't always have all the tools or the knowledge at your disposal, but what you do have is your ability to learn, or your curiousness in how you will approach new things.
Mm-hmm.
And so when I realised that, I started to put myself forward for opportunities or skills or events where, yes, I didn't know everything, but I went into the room and went and found out, and that's how you learn and develop.
What was kind of that moment that your mindset changed, I guess?
Oh, that's a really good question. And I think I like having conversations like this because it just helps you to reflect on your journey, because you forget about these points in life. So definitely when I was 16, I just lacked like that life experience that you do only come with as you grow in life. So at that point, it was just not really going out there and putting myself forward for things. As I then went into uni and became a qualified physio, I think it was probably around the time that I was sort of stepping up from band 5 to band 6, so going from a junior to a senior physio. And as a senior physio at the time, the team I was working in, it wasn't a bad thing, but it felt like a step up in that I was just thrust into the role and you need to do this and you need to do that. But I wasn't always kind of given the opportunity to understand, well, how do you do that? So I had to go and find out myself and take charge of my own learning. And I think from that point I realised, well, had I just shied away from them opportunities and said, no, I can't do it, or you need to find somebody else, I would have never gone through that learning.
Can you share a pivotal moment in your career journey that has made a significant impact?
I think 100% taking the opportunity to move from a clinical role to a corporate role. The two worlds, if you like, of the NHS are very different, although complementary, because one can't function without the other. And I think as a clinician, I loved what I did. I enjoyed seeing patients, putting together treatment plans, and then having the initiative and the experience to be able to then see through them treatment plans. But I always felt that I had an interest in a lot of different things. But one thing I had was service improvement, and how do we're not always going to have more money come through the door. Therefore, how do we work with what we currently have to improve the ways that we work? And some things you can change, others you just can't. But what is within our capacity to change, I was an advocate that we should change the way we work in order to see more efficiency and better results at what we do. But when you're a clinician, you just don't have the time to implement that, because it's about seeing patients, getting through the list and getting them out the door, essentially. So when I moved into the corporate world, into a digital project management role, it was very different. You had the time to be able to sit with services. That was essentially my role. Sit with services, understand the problems, and find out what solutions we can put in place to help with that. So that was definitely a pivotal moment. And I think from one department to another, one was very much patient focused. You don't have time, whereas this was different pressures in a different way, but you were the one then bringing the solution.
So how do you approach challenges and setbacks in your professional life, and what is your go-to strategy for overcoming them?
I think gathering information or trying to understand, because often when you have a problem, it's not just related to one person or one issue. It's part of a wider system or systemic issue that might be happening in the organisation or the team that you're working in. So there's always different perspectives that come with that. So it's understanding, well, X is bringing a problem and saying this is an issue. How is it affecting the rest of the team? How does it affect what we are supposed to deliver? And does it affect the timescales or timeline of delivery that we have? So it's about gathering information, keeping a cool head and keeping calm under pressure.
Sometimes, isn't it?
Definitely. I think, like, for example, yesterday, some frustrations were shared in a meeting, and I'm like, it's really your instinct, or my instinct, because I feel like I need to resolve the issue there and then. But you have to be realistic and think, it's not always my problem to solve. I can listen, I can take back your concerns, but I might not always, it's recognising your role. So in some roles, yes, I'll be the problem solver and I'll move to solve that. In others, I can't really change it, and you have to just be open and honest and hear what people are saying, empathise, agree, but then also make clear where your role starts and begins with that.